Our heart rate is very regular, that the rhythm's very slow. We're at 88 beats per minute. It's a good thing.
Oh, it's recording.
Yeah. And then the other thing I should mention to you, I did examine the eyes. There's chronic pigmentary keratitis, so the brown pigmentation in the little streaks across the cornea. And there's a lot of mucus beyond what I would expect just from infections. I think we may have a little bit of KCS or dry eye as well.
Okay.
Has this dog had a Schirmer? I didn't see a Schirmer. They did?
Yes.
And it was okay?
Well,
Let's see one in there. Did VC?
it's on my bill.
Oh.
So I don't know the results.
Okay. So at some point, we need to call over there and find out the results on the Schirmer.
Did they give you any meds?
It did
he had
say they were
green
doing
discharge.
fluoxetine eye drops every 6 hours. It said in the
Is
chart.
that for antibiotics?
That's antibiotics.
Yeah, because he had green discharge.
Yeah, and he still does have quite a bit of discharge, but that's probably going to take a while. Okay, go ahead and hold him up. Yeah, I've already seen that record. They sent that over to me.
So,
Please just hold on.
looks like they did a cytology on the anal gland thing that's really hard. They said it was...
The right one, they said it was inflammatory and consistent with a possible abscess, chronic infection. They can't entirely rule out cancer, but the treatment of choice would be to go in and resect that gland. It's okay. I'm not going to hurt you.
Poor guy.
Goodness. And really firm testicle here. Ooh, it's okay. I'm not going to hurt you.
Which they were wanting to biopsy.
Yeah. You know, okay, they're both descendants, so we're not crypt. We've got one
Oh,
here
they
and
put
one
that he was
there.
crypt orchid.
I don't know about that. There's a separation between the two testes here. This is one, and this is the other.
Or was it the shelter that said crypt orchid?
It's probably the shelter. Yeah, so this one, definitely I would recommend biopsying because it's firm and it's about twice the size of the other testicle.
Okay.
It's okay, so that's the left testicle.
This poor guy. We're calling him Mr. Wilson. That's his new name. Oh, hey, Mr. Wilson, do you remember me from yesterday?
Oh.
Or wait, Tuesday? Yesterday? My whole week's just... Yeah, 2 days ago. It was Tuesday. Today's Thursday.
And we're a little bit dehydrated. Oh.
Mr. Wilson? Can you live a few more years?
Does someone try?
We would really like that.
Okay, let's gently put him on his side. I want to palpate these joints.
His rear needs are awful. I don't know if you saw him walk. It's wobbly.
Yeah, they like fall
Yeah,
out.
he's got... But I wouldn't do knee surgery on an old dog like this. I would just try and make him comfortable.
Exactly. Reducible or not? We've got a nice hernia here, about 2 centimeters. Non-reducible. That should be repaired when we...
Okay, that's an umbilical hernia probably
Yeah.
from birth.
Yeah. It's a non-reducible kind, which means it can't be pushed back in, but either way we repair those.
He shakes a lot too. I think he might need Adequan or whatever your pain injections old dogs get. This old guy.
He needs some pain medication, absolutely. And it looks like they put him on trazodone and tramadol so far. He's got some alopecia there. It's okay, then. It's okay.
Mr. Wilson. You're such a nice little man.
Yeah, so he's definitely a grade 4. His patella is permanently luxated there.
Is it lateral? Or is it
It's
just
medial.
oh
but
so it's
stuck.
popping it's out.
It
Okay.
basically stays medial, yeah.
Okay.
It's okay, sweetheart. But there's quite a bit of arthritis that I can palpate there. It's okay. It's okay. It's okay.
Shaky.
Good
Poor
job.
little
I'm
guy.
not gonna hurt you, sweetheart. I know.
Poor little man.
Yeah. Good.
I don't know if Danielle showed you his before pictures. He was all mad. Like, it took the groomer hours. He had to bathe him several times.
How long had he been at the shelter?
A month. I didn't know he was there because he was in a back. Well, they didn't have him out for the general public to see. So I didn't know he was there. And I was there to look at another dog and then saw him. I'm like, oh boy. And on the shelter records, it said the owner had just hosed him off and brought him in soaking wet. So he must have been worse. Like he must have been feces covered.
That is just.
So they walked him in the shelter. He was drenching wet. And he's a nice dog.
There should
So
be a place where we put people like that.
I wish they just could never have a pet again.
Food in the cage and go, oh, here you go. Maybe it's called jail.
Yeah.
There's a good place for people. Like
Fortunately, our animal laws don't. They don't do anything to these owners. You're nice. You're a nice little guy.
Kiddo.
Oh, Periscope is a.
I just wanted to give him privacy while he was
Oh, you're giving him some privacy?
Yeah.
Mr. Wilson. Oh, we haven't put that his name is Mr. Wilson, have we?
On my last one, I just did. I said, Mr. Wilson, after that. He slept the whole car ride.
Oh, I think he's old dude, right? Like, I want to see what Dr. Stirewalt thinks. Because he's not 11. No.
I think he's older than that. Maybe probably put him more like 14.
I was thinking, yeah. Oh, here. Oh, this is still recording.
Although neglect and abuse definitely ages them.
Yeah, that's true.
It's like this sweetheart. So the majority of the abnormalities I'm palpating elbows and knees. Believe it or not, the hips, they're more atrophied, but I believe they're more atrophied because we have such significant joint disease in the stifles. We haven't been really weight bearing as much as we would if we had healthy knees. And so that's just led to some pretty chronic changes in arthritis in those joints.
Look at him. He's just closing his eyes and tolerating this. What a good dog. Handsome little guy.
Yeah, see, so here's the division between the two testicles, and you can see it here.
So it's not
And I can
cryptic.
float this one up now. And I
Okay.
can float both of them up, actually. So here's
Oh, I think to get the screen back, you have to hit the front. I don't know. I don't know how to use the camera really. It's new, and I don't really.
Yeah.
I have to get it there.
and then we've got these 1, 2, 3, 4 little plaques here
Little
adjacent to
nodules.
the prepuce, and these may be, viral papilloma type growths, and they also can be, we call them carians, which are like keratinized growths, but that's what they look like to me. Probably benign, but we want a biopsy at least, to find out for sure. And then this is just a nice little hernia off to the side there. It's okay, sweetheart.
He's so
It
good.
is so good. And then this little nodule,
Yeah.
it looks more benign, it's pretty encapsulated, but you can't really say that for sure without a biopsy. That potentially could be biopsied too.
Okay.
Let me do rectal. I should check out that anal gland area.
Oh, you're so good. Look how good he
He's
is.
very good.
Oh. We love you, Mr. Wilson. I know you can't hear.
Yeah.
But you know what? They read our body language. So when you talk,
We
you bring
love
up more
you.
body language.
We love you, Mr. Wilson. That's a good regal name for him.
Yeah.
Oh, this thing can take. This
Oh, it
is
wasn't-
his.
yeah.
Oh no, I thought that was from the shelter.
Oh.
Okay, no, that's from the VCA. That can. Oh, he's getting his little tushy exam. Sorry.
Sorry, bud.
Oh, I'm gonna turn this off for a second, just in case he starts to scream or something.
Yeah.
That would be bad. People would be upset if they heard him screaming or something. Look how stoic he
He
is.
is a good boy.
Okay, good boy. Good.
Good.
When we were
Nice
at
and
the
expressive.
Meal place, we
It's a
would go
little
up to everyone
kitty.
and like sniff them and then like look
Oh.
Let's see about the other side, honey. That was your dad's side.